Okay, let's see here. Alright, I want to make a video about this coronavirus. I think some people are under the impression that it only seems to affect people older, I guess people like my age, people in their 50s, 60s, 70s, 80s, people with pre-existing conditions, people with conditions like emphysema, heart problems, diabetes, hypertension, or so forth. We don't know that there was a doctor in China, Wuhan, China, where the epicenter was, and with the first outbreak, and he brought that to the attention over WeChat in China, that social media platform they use, and the government in China sent the police to arrest him for spreading rumors. Then later on he died. But anyway, I'm making this video because people should be really aware. People think this is like the flu, and that thousands of people die each year from the flu and so forth. The thing about the flu, though, is that the flu usually can kill kids. Like I seen people on TV, one mother on TV who said her daughter, I think her daughter was like maybe teenager, probably 13 years old, something like that. She died. She had the flu. But with this virus, you don't really hear of anybody that age, that young, or maybe like say 7 years old, 5 years old, who would be dying from this virus. It doesn't seem to be happening. It seems to be attacking like people who are much older. But at the same time too, there's an article here from the New York Times, and they posted it twice, Saturday and Sunday today. Today's Sunday, the 15th March. Two women fell sick from the coronavirus. One survived. All right. The young medical professionals who worked long hours on the front lines in Wuhan first came down with fevers. Within weeks, both were in hospital beds hooked up to IVs or oxygen machines. And there are the pictures right there. Deng, Dang, Jing, and Shi CC. The young mothers didn't tell their children they had the coronavirus. Mama was working hard, they said, to save sick people. Instead, Deng Jing and Shia CC were fighting for their lives in the same hospitals where they worked, weak from fever and gasping for breath. Within a matter of weeks, they had gone from healthy medical professionals on the front lines of the epidemic in Wuhan, China, to coronavirus patients in critical condition. The world is still struggling to fully understand the new virus, its symptoms, spread, and sources. For some, it can feel like a common cold. For others, it is a deadly infection that ravages the lungs and pushes the immune system into overdrive, destroying even healthy cells. The difference between life and death can depend on the patient's health, age, and access to care, although not always. The virus has infected more than 132,000 globally. The vast majority of cases have been mild, with limited symptoms. But the virus's progress can be quick, at which point the chances of survival plummet. Around 68,000 people have recovered, while nearly 5,000 have died. The fates of Ms. Deng and Ms. Chia reflect the unpredictable nature of a virus that affects everyone differently, at times defying statistical averages and scientific research. As the new year opened in China, the women were leading remarkably similar lives. Both were 29 years old. Both were married, each with a child on whom she doted. So let's stop there for a moment. These women were young. They were only 29 years old, not even 30. Only 29 years old. Of course, they were working in an environment, but you would think, like some people say, well, it's like the common cold, and I've heard people argue this, like people who say, like one particular party is just trying to destroy the president of the United States, you know, to destroy him so he wouldn't be reelected, and don't listen to these people. And this virus is nothing but like the common cold, or like a flu. And a flu is terrible, by the way. If you ever had a flu, you have shakes and fevers and so forth. So a flu is not it's not really that mild. Maybe a cold is mild in comparison, but not the flu. But anyway, let's continue. Miss Deng, a nurse, had worked for 3 years at Wuhan, number 7 hospital in the city where she grew up and where the coronavirus pandemic began. Her mother was a nurse there too, and in their free time, they watched movies or shopped together. Miss Deng's favorite activity was playing with her 2 pet kittens, Fat Tiger and Little White, the second of which she had rescued just 3 months before falling sick. And there she is right there, Miss Deng. This is the nurse with her daughter right there. Okay. Now you see somebody like her, and you will ask yourself, how can somebody like that doesn't seem to have any kind of pre-existing conditions or anything like that, and yet fall sick? Dr. Shia, a gastroenterologist, also came from a family of medical professionals. As a young child, she had accompanied her mother, a nurse, to work. She joined Union Jiangbei Hospital of Wuhan in 2015 and was the youngest doctor in her department. Her colleagues called her Little Sissy or Little Sweetie because she always had a smile for them. She loved Sichuan hot pot, a dish famous for its numbingly spicy broth. So there's Dr. Shia right there, also 29 years old. Dr. Shia loved traveling with her family. She had recently visited Wuhizhou Island, a resort destination off the southern coast of China. When a mysterious new virus struck the city, the woman began working long hours, treating a seemingly endless flood of patients. They took precautions to protect themselves. So it's not like they just went in there, carefree, didn't do any protection. They took precautions. And I know because, for somebody like me who work in the healthcare um, industry, and I've done that like years and years back, work in hospitals, nursing homes, and so forth. And sometimes you have to do treatments, and you have to put your gown on, Even the mask, not the little mask you put over the nose, but you have like the shield too. You put the shield on to protect your whole face, your eyes. Like if you're doing suctioning, you suction in the patient. Sometimes a patient may have like a trach or a tracheostomy, as they call it, and you have to like take the tube and you hook it up to a suction machine. You put it on, and you have to put it down here where that opening is in the neck. And sometimes they like, and sometimes you see like spill all sorts of liquid would spill up. So if your face is like open like that, you don't have any shield, you can have all that stuff on you. Now, in most people, most patients, it's not going to be really an issue. It's just that it comes across as like, wow, really kind of disgusting, to have that spilled on you. So that's not really going to kill you. It's not going to cause any kind of disease or anything like that. However, with this type of virus and knowing the patients you're dealing with, it's best that you protect yourself. So, and I'm kind of like dwelling in this to show that these women did go through the process to protect themselves. See, they took precautions to protect themselves, but they succumbed to the infection, the highly contagious virus burrowing deep into their lungs, causing fever and pneumonia. In the hospital, each took a turn for the worse. One recovered, one did not. So these two ladies, health professional, they took precautions, and I'm assuming they have something similar. In China, from what I see the people with the gowns, they put the gowns on, the face masks, and so forth. So I'm assuming, and even though they did all that, still they were able to breathe in this the virus that entered their lungs, and that's where the trouble starts, because this is a respiratory this is a respiratory type virus that affects the lungs, different from Ebola, which affects like the GI tract, the gastro tract, intestinal tract. So Ebola is very, very different from this. So this one goes into the lungs. And of course, once you have a problem breathing, that's it. You get pneumonia, you're in bed, and it's very, very difficult. Okay, so symptoms, onset of virus and hospitalization. So there's Miss Deng here to my left, and the Dr. Chia to the right, to my right. The symptoms came on suddenly. Dr. Chia had ended her night shift on January 14. January 14. This was just 2 months ago. Today is March the 15th. So January 14. That was 2 months ago, when she was called back to attend a patient, a 76-year-old man with suspected coronavirus. She she dropped in frequently to check on him. 5 days later, she started feeling unwell. Exhausted, she took a 2-hour nap at home, then checked her temperature. It was 102 degrees. Her chest felt tight. A few weeks later, in early February, Miss Deng, the nurse, was preparing to eat dinner at the hospital office when the sight of food left her nauseated. She brushed the feeling aside, figuring she was worn out by work. She had spent the beginning of the outbreak visiting the families of confirmed patients and teaching them to disinfect their homes. After forcing down some food, Miss Dang went home to shower. and then feeling groggy, took a nap. When she woke up, her temperature was 100 degrees. Fever is the most common symptom of the coronavirus, seen in nearly 90% of patients. About a fifth of people experience shortness of breath, often including a cough and congestion. Many also feel fatigue. Both women rush to see doctors. Chest scans show damage to their lungs, a telltale sign of the coronavirus that is present in at least 85% of patients, according to one study. In particular, Ms. Deng's CT scan showed what the doctor called ground glass opacities on her lower right lungs, hazy spots that indicated fluid or inflammation along her airways. The hospital had no space, so Ms. Deng checked into a hotel to avoid infecting her husband and 5-year-old daughter. She sweated through the night. At one point, her cough twitched. In the morning, she was admitted to the hospital. Her throat was swabbed for a genetic test, which confirmed she had the coronavirus. Her room in a newly opened staff ward was small, with 2 cots and a number assigned to each one. Miss Deng was in bed 28. Her roommate was a colleague who had also been diagnosed with the virus. At Jiangbi Hospital, 18 miles away, Dr. Chia was struggling to breathe. She was placed in an isolation ward, treated by doctors and nurses who wore protective suits and safety goggles. See? Protective suits and safety goggles. The room was cold. So let's see here. Treatment. Day 1. Hospitalization begins. When Miss Deng checked in the hospital, she tried to stay upbeat. She texted her husband, urging him to wear a mask even at home, and to clean all their bowls and chopsticks with boiling water or throw them out. Her husband sent a photograph of one of their cats at home. Waiting for you to come home, he said. I think I'll take 10 days, half a month, she replied. Take care of yourself. There is no known cure for COVID-19, the official name for the disease caused by the new coronavirus. So doctors rely on a cocktail of medicines, mostly antiviral drugs, to alleviate the symptoms. Ms. Deng's doctors prescribed a regimen of Abadal, an antiviral medicine used to treat the flu in Russia and China, Tamiflu, another flu medicine more popular internationally, and Kaletra, an HIV medicine thought to block the replication of the virus. Ms. Deng was taking at least 12 pills a day, as well as traditional Chinese medicine. There's one right there, Abadal hydrochloride tablets. Okay, despite her optimism, she grew weaker. Her mother delivered home-cooked food outside the ward, but she had no appetite. To feed her, a nurse had to come in at 8:30 each morning to hook her up to an intravenous drip with nutrients. Another drip pumped antibodies into her bloodstream, and still another antiviral medicine. Dr. Chia, too, was severely ill, but appeared to be slowly fighting the infection. Her fever had subsided after a few days, and she began to breathe more easily after being attached to a ventilator. her spirits lifted. On January 25th, she told her colleagues she was recovering. "I will return to the team soon," she texted them on WeChat. "We need you the most," one of her colleagues responded. In early February, Dr. Chia asked her husband, Wu Shili, also a doctor, whether he thought she should get off oxygen therapy soon. "Take it easy, don't be too anxious," he replied on WeChat. He told her the ventilator could possibly be removed by the following week. "I keep on thinking about getting better soon," Dr. Chia responded. There was reason to believe she was on the mend. After all, most coronavirus patients recover. You see that? Most recover. Yeah, most recover. Later, Dr. Chia tested negative twice for the coronavirus, so that means the drugs apparently were working. She told her mother she expected to be discharged on February the 8th. Now, decline. Day 4 to day 16 after hospitalization. The pictures here in the hospital. Miss Deng's only contacts were her roommate and the medical staff. She added a caption to a photo with her doctor, saying laughter would help chase the illness away. 2 tests indicated that Dr. Chia was free of the virus, but her condition suddenly deteriorated. Okay, so this is Miss Deng on the left, Dr. Chia on the right. Right there, and she's wearing a mask, face mask. Both of them are wearing face masks. By Miss Deng's 4th day in the hospital, she could no longer pretend to be cheerful. She was vomiting, having diarrhea, and relentlessly shivering. Her fever jumped to 101.3 degrees. Early in the morning on February 5th, she woke from a fitful sleep to find the medicine had done nothing to lower her temperature. She cried. She said she was classified as critically ill. The next day she threw up 3 times until she was left spitting white bubbles. She felt she was hallucinating. She could not smell or taste, and her heart rate was slowed to about 50 beats per minute. On a phone call, Ms. Deng's mother tried to reassure her that she was young and otherwise healthy, and that the virus would pass like a bad cold. But Ms. Deng feared otherwise. "I felt like I was walking on the edge of death," she wrote in a social media post from her hospital bed the next day. China defines a critically ill patient as someone with respiratory failure, shock, or organ failure. Around 5% of infected patients became critical in China, according to one of the largest studies to date of coronavirus cases. Of those, 49% died. Those rates may eventually change once more cases are examined around the world. While Dr. Chia appeared to be recovering, she was still terrified of dying. Testing can be faulty, and negative results don't necessarily mean patients are in the clear. She asked her mother for a promise. Could her parents look after her 2-year-old son if she didn't make it? Hoping to dispel her anxiety with humor, her mother, Jiang Wenyang, chided her. "He's your own son. Don't you want to raise him yourself?" Dr. Xia also worried about her husband. Over video chat, she urged him to put on protective equipment at the hospital where he worked. She said, She would wait for me to return safely, he said, and go to the front line again with me when she recovered. Then came the call. Dr. Shear's condition had suddenly deteriorated. In the early hours of February 7th, right, her husband rushed to the emergency room. Her heart had stopped. Now, recovery, day 17 after hospitalization. There's a picture there of Miss Deng with her mother. Miss Deng on the left and her mother on the right. Right there, both wearing masks. In most cases, the body repairs itself. The immune system produces enough antibodies to clear the virus, and the patient recovers. By the end of Ms. Deng's first week in the hospital, her fever had receded. She could eat the food her mother delivered, and February 10th, as her appetite returned, she looked up photos of meat skewers online and posted them wishfully to social media. And February 15th, her throat swab came back negative for the virus. 3 days later, she tested negative again. She could go home. Ms. Deng met her mother briefly at the hospital's entrance. Then because Wuhan remained locked down without taxis or public transportation, she walked home alone. So imagine this. She was discharged from the hospital after being in critical condition, and she had to walk home. There's no taxi, no public transportation. Wuhan is locked down, and the only way to get home, she had to walk home. Imagine that. Think about that. You discharged from the hospital after being in critical condition, and you had to walk home. I felt like a little bird, she recalled. My freedom had been returned to me. She had to isolate at home for 14 days. Her husband and daughter stayed with her parents. At home, she threw out her clothing, which she had been wearing for her entire time in the hospital. Since then, she has passed the time by playing with her cats and watching television. She jokes that she's getting an early taste of retirement. She does daily deep breathing exercises to strengthen her lungs, and her cough has faded. The Chinese government has urged recovered patients to donate plasma, which experts say contains antibodies that could be used to treat the sick. Ms. Deng contacted a local blood bank soon after getting home. She plans to go back to work as soon as the hospital allows it. It was the nation that saved me, she said, and I think I can pay it back to the nation. And then here we have death, day 35 after hospitalization. And there's a memorial here. We see some apples, bottle of water, pictures there, pictures right there of the doctor, Dr. Shear. On Dr. Shear's desk at work, her colleagues left 1,000 paper cranes, a Chinese symbol of hope and blessings. Written on the wings was a message: rest in peace. We will use our lives to continue this relay race and prevail over this epidemic. It was sometime after 3 a.m. on February 7 when Dr. Shear was rushed to intensive care. Doctors first intubated her, then the president of the hospital frankly summoned several experts from around the city, including Dr. Peng Ji-young, head of the Department of Critical Care at Jiangnan Hospital. They called every major hospital in Wuhan to borrow an extracorporeal membrane oxygenation, or ECMO, a machine to do the work of the heart and lungs. Dr. Shear's heart started beating again, but the infection in her lungs was too severe, and they failed. Her brain was starved of oxygen, causing irreversible damage. Soon, her kidneys shut down, and doctors had to put her on round-the-clock dialysis. The brain acts as a control center, Dr. Peng said. She couldn't command her other organs, so those organs would fail. It was only a matter of time. Dr. Shea slipped into a coma. She died on February 23rd. So February 23rd, that's a little less than a month that we're talking about. Because today's the 15th. So wow, that's like 3 weeks ago. Dr. Penn remains baffled about why Dr. Shea died after she had seemed to improve. Her immune system, like that of many health workers, may have been compromised by constant exposure to sickness. Perhaps she suffered from what experts call a cytokine storm, in which the immune system's reaction to a new virus engulfs the lungs with white blood cells and fluid. Perhaps she died because her organs were starved of oxygen. Back at Dr. Shea's home, her son, Jiabao, which means priceless treasure, still thinks his mother is working. When the phone rings, he tries to grab it from his grandmother's home hands, shouting, "Mama, Mama." Her husband, Dr. Wu, doesn't know what to tell Jiabao. He hasn't come to terms with her death himself. They had met in medical school and were each other's first loves. They had planned to grow old together. "I love her very much," he said. "She's gone now. I don't know what to do in the future. I can only hold on." So this is a very human story out of China, and I mean, we can all relate to something like that, And I thought I'd bring this up and read it because I see it again today in the newspaper, and the column was not even open. The New York Times didn't open the column, where usually you can get in there and write a comment, say something. I didn't think that was right. I think, with these two ladies, one was a doctor, one was a nurse, and obviously they were trying to help people. They were trying to save lives, and one of them died in the process, and the other one was gravely ill, came close to death. So the fact that, you know, yeah, we have an article, and it's a good thing an article was written, but at the same time, there's no way for any of us to really get in there and make a comment. So this is one of the reasons I wanted to do this video, and also that people should know that not because you may be young or 30 years old or what have you, that this can't happen to you. We just don't know. And this is not like the common cold, you know? It's not like the common cold because these two ladies were 29 years old and they died. 29 years old. That's young. And it's kind of unfair, but that's how life is sometimes. Life can be unfair. To have a doctor who was out there in the forefront, a gastroenterologist, saving lives, and she just died because of this virus. So that's it. So anyway, this is what I wanted to report on. So people have to be careful out there. Watch yourself. Have that social distance, like they said. Use hand sanitizers. Wash your hands always, and take care of yourself. And be good to each other. Take care.